Hi, I'm Dr. Mike Milligan. I'm here at the ADA meeting in Orlando, Florida. I'm here, a super treat for you here, Dr. Keith Thornton of Dallas, Texas, inventor of the TAP appliance for sleep apnea. Keith, thanks so much for being with us.
Absolutely. Thank you for having me on and discussing this. Obviously, it's my passion.
Well, this is a real honor to have you here, the developer of the TAP appliance, and it's the most used appliance out there for sleep apnea.
Today, yes, that's correct. In fact, this has been going on for 17, 18 years that I've been working on it, and so far we have probably 150,000 out there. Wow. Being used today.
Wow. Now, you know, sleep apnea is a coming thing in dentistry. We some regulations and things have come about in the last few years to make it a real expanding service. Fabulous service for our patients. Can you tell us a little bit about some of the patients you've treated, maybe, that and what you get out of this, just spiritually yourself, for treating sleep apnea?
Well, and that's kind of the things that I talk about, and what's so much fun about what we're doing compared to anything I ever have done in dentistry. Yeah. As we talk about it at the Pankey Institute, the spiritual reward that you get out of this is by far better than anything I've ever done.
Ever done in dentistry?
Ever done in dentistry. So it's such a exciting field. You know, I can think of numerous patients that either saved their career, almost tell them saved their life, things like that. We had a patient in recently that had 5 sleep studies and nobody could figure out what was wrong. Yeah. And she had a mild case of what we call high upper airway resistance. 2 days, she was totally cured of it and was feeling a lot better, and was on 10 different medications, including heart medication. So wow. It's such a ubiquitous disease that, as I tell patients, sleep apnea is essentially a mechanical problem. And as dentists, we are probably the best mechanics of the head and neck of any place. Right. So essentially what I tell people, it's like doing CPR on somebody every night, and it keeps their airway open. And with doing that, we can manage most people with sleep apnea much better than blowing air up your nose at 85 miles an hour with
right.
CPAP,
right.
which I say.
Right.
So it's a fun thing, and it really is wonderful for our own patients that are in our practice, besides developing a huge number of following and new patients, that come in to see me.
And the other thing that we were talking about was, once you treat them for sleep apnea, many say, well, you've saved my life, and now they're ready to do comprehensive dental work.
Exactly right. And as we were talking about, my practice has really been restorative dentistry for all my life, third generation. And in the last 10 years of my practice, when I was practicing general dentistry, that the largest group of patients that came in were men that were referred by their wives who had not been very meticulous with their dental care. Yeah. And you bonded with them, they got rid of their snoring, and got their wife back in the bedroom with them. Right. And so they appreciated what I do, and then we could go ahead and talk to them about taking care of their teeth the rest of their life.
Referred was a nice word. It is probably really the wife saying, you get in there and get
whatever.
That snoring taken care of.
You know, whatever it is.
So tell us a little bit about the TAP appliance and you know, the development of that, and it's the most used appliance out there.
Right. Generally, what I tell people is just like doing CPR. And when everybody starts to talk about the mechanics, I want to make it as simple and easy, both for the dentist and for the patient. Okay. And as we talk about CPR, I ask, well, how far forward do you put a patient when you're doing CPR? Okay. Well, everybody looks at me and say, well, I don't know. I said, far enough to keep their airway open. Okay. Very, very simple. We know that the airway can be managed the further forward you put the jaw, because it manages the epiglottis and opens the airway up. So I did was say, okay, let's take this and be able to do it and allow the patient. So there's two things. that make this more effective and proven more effective than any other device is that it is patient adjustable from the front, so the patient can adjust the jaw out, and also it can go further out than any other appliance. So academically, we have more studies on this in peer-reviewed medical literature. So from that standpoint, it really is, we've shown that it really is a great medical device.
Okay, so the two main points about the tap is the patient can adjust it themselves once it's already in.
That's correct.
Move it even more forward or back or whatever. And then also, you said the other one was
that it can go further forward
than any other appliance.
Great.
Okay. Super.
Success is really based on how far forward it can go. We don't know where what that sweet spot is, and so we've got to keep measuring that. And the patient gets older, gets more obese, drinks a couple of drinks at night, so they actually can manage their own airway, and they learn how to manage their own airway.
Fantastic. So now, what else would you like to tell us about the TAP appliance before we close here?
I think the easiest thing is that it is incredibly simple for anybody to do.
Oh, absolutely.
In all my career, I've had only auxiliaries doing this, and it really gives that auxiliary a practice of their own where they get that patient reward and feedback. So very productive, very easy. Patients are very appreciative, so it's just simple.
Right. Once you learn the sleep studies and the procedures here, all of this can be delegated to an assistant.
Virtually all of it.
And so it's a highly productive procedure.
Highly productive
for the practice, but a fabulous procedure for the patients.
It really is. People will appreciate you more for this than anything else that you do.
You bet.
Essentially, the device is a device that will protrude the mandible forward like we do in CPR. So essentially what I did is develop a hook on the upper in the midline with a jack screw that will move the jaw forward, a receiver on the lower appliance, and a way to lock the two of them together. So essentially what the patient does is we put it at a certain protrusion forward and start out at that point, and then the patient can use a key that goes into the central slot and are able to titrate the appliance out. I'll show you. So, and when I have a patient in the chair and the wife is there, I ask them what this is, and they say, well, it looks like a hex key, and I say, no, it's really a volume control knob, so that if your husband is still snoring, you can turn it in and turn it to the right, and you can turn him off with that. So that's really all it does. Is the patient is absolutely in control all the time, and is able to move that jaw very incrementally forward, so it minimizes the discomfort and allows them to get used to it much easier than anything else. And it's robust, and it virtually is indestructible. So those are really the TAP appliance.
Great. Now let me just see the occlusal of each. Okay, so I'm gonna zoom in right there. And so, how do we get a hold of you?
Through tapintosleep.com.
Okay.
Yeah. So that's the main way. That's the best way. Right.
Fantastic. Well, Keith, thank you so much for being with us.
Thank you for the interview.
Great.
Absolutely.
Great.